CWSHIN would not exist without the engagement and the participation from all the practitioners, from the laboratories, and of course the funding from the provincial pork boards and governments. The people are really the key to make it work.
With us today, we have Dr. Jette Christensen, who will be talking to us about the Canada West Swine Health Intelligence Network. Welcome, Jette. How are you today?
Thank you for inviting me, and I'm fine here on PEI.
Very good. Yes, I believe you're our first guest from PEI, so it's indeed a pleasure to have you here. And Jette, I wonder if you wouldn't mind just taking a few minutes to give us some background on yourself in terms of, I know you're from Denmark, and maybe tell us a little bit about that and the progress of your career until you ended up in front of your computer here on Swine Canada podcast.
Well, yeah, I think my age will show when I start to tell a little bit about what I've done so far. I did get a DVM from Denmark back in the 80s, and I started my career in practice, actually in an area where we did have a lot of swine, although I mostly took care of the cattle or the dairy in the farm. We had an outbreak of pseudorabies or Augeschis disease, so I was in the middle of trying to diagnose these pigs or herds, and they got eradicated, and we tried to eradicate the disease from Denmark, and also into the later phases where we did bleed all the sows, boars, and 10% of the pigs. So I got a bit of a good introduction into bleeding pigs and the practice about that. But it was also seeing surveillance and disease control from the ground, from the actual herds, and what it felt like to be in practice and talk with the producers on that subject. I then moved to what was called the veterinary services, which was the veterinary authority in Denmark, and worked again with swine diseases and pseudorabies, Augeschis disease, there before I started my Ph.D. And my Ph.D. was in surveillance again, but it was trying to combine production data from farms with records by producers on how they the treatments that they gave the pigs, and trying to combine that. So that I mention that because it's very close to what I'm doing today. I moved while I was doing that. I was employed by the Danish Bacon and Meat Council, which is the organization for all swine producers and abattoirs in Denmark. And then I moved to the National Laboratory as an epidemiologist, working with the Danish Salmonella Control Program and the epidemiologic aspects of that, and working with the data systems and setting that up. I did a few other research projects at that time, and going into the next millennia, I moved to Canada, to Prince Edward Island, and started a job with the Canadian Food Inspection Agency, where I was for 15 years, working again with surveillance, both notifiable avian influenza surveillance, surveillance in swine, over those years. And then about 6 years ago, I left CFIA and started in private as a private consulting, and And now I'm working with the Canada West Swine Health Intelligence Network, which is for the 4 Western provinces and the swine producers and veterinarians there. So that's sort of a very brief story about over 30 years in surveillance.
Working with nature and not against it, piglets fed AX3 see significant and improved feed efficiency. Producers know the reality of needing to reduce antibiotic and zinc use. AX3 Digest is a highly digestible novel protein that promotes improved in-barn performance, piglet health, and minimizes the need for zinc in the diet. For more information, visit www.protecta.com. That's www.protecta.com.
Yes, you're well equipped to handle the position that you're in right now, Jette. So they're very fortunate to have somebody like you. I have a sneaky suspicion that many of our listeners may not be very familiar with the network and exactly what it's doing and what its objectives are. And I noticed in the background information that you shared with us, you made it very clear that you can't be successful at anything unless you have clear objectives. So perhaps you could help our listeners, and certainly help me, to understand the network by exactly what it does and what its objectives are.
Yeah. So question is how we pronounce the acronym, or I pronounce the acronym. It's a little bit awkward, but we serve the Western swine producers, herd practitioners, and governments to improve swine health, production, and the economic prosperity of the swine sector in the 4 Western provinces. So that would be going from west to east. It would be British Columbia, Alberta, Saskatchewan, and Manitoba. As I said, one of the reasons I wanted to work for this network was that they, from the get-go, had very clear objectives of what they wanted. They wanted, for the surveillance objectives, to detect emerging new diseases. They wanted to detect unusual clinical presentation of known diseases. They wanted to provide some information on endemic diseases. And the fourth objective is for the diseases that are absent in Western Canada or in Canada as a whole. The examples that are most talked about right now might be African swine fever or foot and mouth disease. They want us to help provide evidence that we're truly free of those diseases. That aims to support trade, our international trade. So that is 4 very clearly defined objectives. So what we're doing in CWSHIN is that every quarter we send out a survey asking practitioners on their clinical impression on what is going on with different diseases. We also get data from a couple of laboratories. We get data from the veterinary diagnostic services in Winnipeg. We get data from the prairie diagnostic services in Saskatoon. In addition, a couple of research laboratories will send us data on Brachyspira, so occurrence, that is swine dysentery, and influenza. We get specific data on African swine fever testing from 2 provincial laboratories in Alberta and BC. So that is a lot of data that comes together. So the first step is we collate this data, and then I analyze the data, and then we have a quarterly call. At the quarterly call, we invite the practitioners that have participated with the surveys. We invite some of the laboratory experts and representatives from the provincial governments and the provincial pork boards to discuss the findings. And this is really the network part of CWSHIN, where we build the network, we build the trust, we build the communication between practitioners across the entire region so they can exchange their knowledge. And that's a big part of what we do. When that has all been done, our two key publications are a veterinary report that we send out to about 100 practitioners and swine experts in the region, just summarizing what we found in the data, in the analysis, and the discussions at the quarterly call. And we also send it out to over 1,600 producers in the region. They get their version of the report too. So that is the core activities that we do in CWSHIN.
Interesting. And you said over 100 practitioners are involved in receiving the report. So you've got pretty good penetration in the industry across Western Canada then.
There are about 50 practitioners, and then the rest, the other 50 is swine health experts from laboratories, other surveillance networks working in the region.
Okay, gotcha. I went to your website, Jette, to take a look at it. Very interesting website and very well laid out. But when I did my Google search, I found there's also a Canadian Swine Health Intelligence Network. So is that related? Is that a partnership, or are you connected with them in any way?
Yeah, we are part of that. The Canadian Swine Health Intelligence Network is the umbrella of four regional
gotcha.
networks. CWSHIN, which has the W and the West in part of our name, is representing the four Western provinces. Then there is OAN, the Ontario Animal Health Network. Their swine section will take care of Ontario. We have RASO in Quebec, and then we have representatives from the Maritimes too. So actually following our regional quarterly call, there is a national quarterly call where we exchange again with the other networks. So what we do in that setting is we pick up to 3 or 4 topics that were relevant for our region, and we share with the other regions, and they do the same. And that way, there's actually been very interesting discussions where practitioners from east to west can help each other with specific unusual presentations of disease.
If we can talk just a little bit, I want to get into the nuts and bolts of the network, Jette. But before I do that, I'm sure our listeners are wondering who is paying the cost of your network, the network you're employed by, and then the overall national umbrella network. Is this funded by the industry? Is it funded by the government, or combination? How does that work?
Our funding is pretty sustainable. I think in 2018 we made a 5-year plan, and so we had a 5-year plan also for the funding. And the first 5 years there, we had funding from the 4 provincial pork boards and the provincial governments. And it's sort of a 50-50 government pork board financing in each province. And then province by province, it's scaled a little bit by the number of pigs produced. So Manitoba pays more than BC that has fewer pigs, for instance. So it's not a 50-50 among all 8. It's sort of also balanced out by the production in there. So this year we succeeded to get funding for the next 5 year with the same funding model.
Oh, wonderful. Okay, no, that's good. Certainly allows you to do some longer term planning and strategizing. That's great. So when you get up in the morning, Jette, and you're going to work, which I assume is sitting where you are right now, what is it that excites you the most about the position you're in and this network?
Actually, what excites me most about it is the people. The people in the network are helpful, they're friendly, they're engaged. They seem to respond to all my questions and weird demands or requests pretty promptly. And I get a lot of good feedback from pork boards representatives, from the practitioners, from the laboratories, and so on and so forth. That is really what makes it fun to go to work.
Probably say that about a lot of positions, right? People do make the difference.
Yeah.
I'm going to ask the same question, but from the opposite perspective. What is it about the position that causes you angst? What is it? And I'm not looking for the bread and butter day-to-day administration, but the actual functioning of the network. What is it that causes you to be a bit apprehensive or a bit concerned? Obviously, I'm sure foreign animal disease comes in there, but let's set that aside. Just with the diseases that are endemic in Western Canada now, is there anything about the network, the things that you're seeing, that cause you to be concerned?
Mostly it is that it seems to be very well received, and there's a lot of people depending on it, but the staffing is pretty much a one-woman show.
Yeah, right.
So,
okay, yeah.
So it's more the sustainability, thinking about how can this continue even if I step down.
Right.
That would be a concern, and so it's really the backup of every function in the system that is the weakness and what we want to address over the next 5 years.
Right. Gotcha. Okay. Well, that makes sense. Yeah, that makes sense. Okay. Now, my next question for you is a bit different, and that is, you worked in surveillance and, if I can call it, epidemiology in Denmark, and then you moved to Canada, and you've been working in Canada for quite some time now. The industry in Denmark is structured very differently compared to the industry here, or in Canada, pardon me. And so what's it like to work within the Canadian industry as compared to the Danish industry, which is much more structured?
I think the big difference is that if we're just looking at Western Canada, for instance, we have 4 provincial governments and we have 4 provincial pork boards, and sometimes we need to consider the national Canadian Food Inspection Agency too. So we are easily up talking about 9 partners there. And if you have to include laboratories, we are easily into 3 or 4 just to get Western Canada covered. In Denmark, there's 1 industry, 1 laboratory, and 1 government. Right. So that's 3 partners. So everyone has a slightly different approach. Everyone has a slightly different perspective. All of the approaches and all of the perspectives could be valid, or most certainly are valid. So it's just it just takes a little bit more of project management or management to get something off the ground when you have so many partners. I think that is the fundamental difference. When it comes to surveillance in itself, I think it's pretty much the same principles.
Okay.
If you want surveillance to succeed, you need 4 elements, I usually say. You need science, you need project management, you need communication, and you need documentation. And you just need all 4 of those to lift a surveillance unless you're talking about surveillance in one herd or something, then you might get off a little bit easier. But if you have so many partners in surveillance, then you really need all four elements.
Right. Yeah, and that makes sense. That makes sense. I think my last question of you on the subject of the network, Jette, is there one disease right now that seems to capture the attention of your veterinary partners more than any others, in terms of that they are particularly concerned with and they're particularly interested in the surveillance information that you generate?
That is hard to say. There are a couple that attracts attention. One is Seneca Valley virus, which is primarily driven by the work that the provinces are doing, due to the fact that Seneca Valley virus is present in the US. It causes blisters. And so it could look like foot and mouth disease. So
wow.
it is a nightmare for CFIA and USDA, because they have to follow up. Every time you see a pig with blisters, they have to follow up or investigate and rule out foot and mouth disease, basically. So that's a problem with the disease. And it apparently shows up very quickly. So you can have particularly cull sows is the issue, going through assembly yards to the US for slaughter. And so they can look fine when they leave the herd, but then when they show up at assembly yards, they can have blisters. Or what happens more frequently, or has happened more frequently, is they leave the assembly yard looking good, but before they arrive at slaughter in the US, they show blisters, and then you have the trouble. So that is a disease that have governments, in plural, concerned. It's not really hit the producers or the barns yet. Another disease that have been of particular interest is very rare. It's only hit 2 systems in Canada since 2019, and it's Streptococcus equus epidemicus, which is basically killing mature animals pretty quickly. And it will kill sows. They will show slight depression, go off feed, and within 12 hours they're dead. And it's huge mortalities. It's not just a single one. So it's really a nasty disease that you don't want. And so far, the network has discussed different control options, but as far as I know right now, depopulation is the only thing that might work.
Right.
So that's another one. And the network has really been useful because at the quarterly calls, it's been discussed as a new emerging disease. Very quickly after the first sow started dying, it only took a month and a half before we were discussing it. So across the country, actually, it's very, very rare, thankfully, but it's one of the diseases. The other diseases that are coming up is circovirus. Seems to be changing a little bit. It used to be mostly PCV2, sorry. Now it seems to be more PCV3 coming up. And so we're keeping an eye on that. For that, I'm also reaching out to our counterparts in the US, the Swine Health Intelligence Center, and talking with their technical experts to see if they see similar things in the US as we do here. So there's an exchange every quarter with them too. So CWSHIN is really a network in the region, but it also reaches out across Canada and to other partners. So I think that is the few diseases I would highlight. right now.
Right. Yeah. Yeah. Could change tomorrow, but that's it right now. Very good. That's the nature of the position you're in, Jette. Jette, thank you very much. This has been very, very interesting. I think it's useful for our listeners to have a better understanding of this network, both how it functions within Western Canada, but also across the country, nationally, and also internationally, as you just described. Do you have, before we leave the subject, do you have any other points you'd like to make or would like to emphasize, any take-home messages for our listeners?
Well, for CWSHIN particularly, I just want to emphasize again and again that CWSHIN would not exist without the engagement and the participation from all the practitioners, from the laboratories, and of course the funding from the provincial pork boards and governments. The people are really the key to make it work.
Right. Yes. As always. As always.
Yeah.
So that's a great point to finish on.
It's time for our famous three.
But before we finish the podcast, Jette, I have three questions for you that we ask of all of our guests. And the first one is, what is your favorite swine-related?
I don't know if it's my favorite, but it's the one that I use the most, and that's diseases of swine, which is pretty obvious.
Yes. Yeah, that one comes up a lot, Jette. And then the next question, we broaden it a little bit. And what is your favorite book, period? So it doesn't have to be related to swine. It doesn't have to be nonfiction. It can be fiction. It can be of any kind. But do you have a favorite book that you've read that you think our listeners might be interested in as well?
Well, I must admit that it's Jane Austen, Pride and Prejudice, and I can watch it in any shape or form, or read the book a couple of, practically every year. So
right.
I can tell you if they deviate from the text in the book, in the movies, and so on and so forth.
Right. Great. And that one has not come up yet. So thank you for that. And then my final question is, in your opinion, what is it that sets apart the most successful professionals in the swine field? What is it that makes them particularly successful?
I would like to narrow it down a little bit to epidemiology and animal health surveillance. And I think in order to be successful in that particular area, even in the swine sector, is you have to be practical. You really have to know how things will work and how it's practical and easy for all involved. We already talked about how a surveillance in Western Canada would involve 9 different parties, and it has to be practical and easy for all of them, and the veterinarians who participate and the producers that participate. Otherwise, you will never succeed.
That's interesting. That I find that very, very interesting. Jette, that's the first time we've heard that observation, but I can relate it to my own field of nutrition. I took my students one time to a feed mill and had a tour by the manager of the feed mill, and he had almost the exact same message. And he said, you cannot be a successful nutritionist if you do not understand the flow of product through a feed mill. And that was a very, very powerful message. And it's kind of the same message that you have. You're relating it to epidemiology. And so thanks for bringing that up. That's a really good point for our listeners to keep in mind as they're looking to develop their careers and achieve success in their own world. So with that, Jette, I'd like to say thank you very much. I've really, really enjoyed our conversation today and learning more about this network and what you're doing, the challenges that you're facing, but critically, the importance of the network in disease surveillance. So thank you very, very much. We really appreciate it.
You're welcome. I was happy to be here and try to explain what we're doing.
Great. Very good. And you have a good day then.
Yeah, thank you.